If you have diabetes, you know how important it is to bring down high blood sugar, which is called hypoglycemia. But it's just as important to stay away from low blood sugar. The name of this condition is hypoglycemia. In this video, I'll explain how to diagnose this state and walk you through 12 ways to tell if you have low blood sugar. Stay with me till the end when I show you the worst sign of hypoglycemia. As a bonus, I'll also list down 4 simple yet effective tips to avoid hypoglycemia. Let's get going. Your body gets most of its energy from glucose, but you need the right amount of it in your system. People with diabetes who have problems with their medicine, food or exercise often have both high and low blood sugar. Hypoglycemia is usually defined as a blood sugar level of 70 milligrams per deciliter or less. It is thought to be too low to keep functioning normally. The American Diabetes Association, or ADA, says that this drop in blood sugar can cause short-term problems like confusion and dizziness, as well as more serious problems like seizures, coma, and in rare cases, death. For this reason, it is imperative that you pay attention to the following 12 warning signs that indicate your blood sugar levels are beginning to drop. Number 1. Perspiration. Sweating is typically one of the earliest indicators that a person has low blood sugar. This excretion is brought on by an increase in the hormone adrenaline, which occurs when blood sugar levels fall. According to studies, an overwhelming majority of diabetics experience low blood sugar and experience profuse sweating. Examine the back of your neck to see if there are any signs of perspiration there. According to Kaiser Healthcare, it should go away shortly after you eat some sugar. Number 2. A mental state of anxiety. When there is a dangerous decrease in the amount of sugar in your blood, your body will produce the hormones epinephrine, also known as adrenaline, and cortisol. This instructs the liver to discharge a greater quantity of sugar into the bloodstream. This may result in anxiety and the physical manifestations of anxiety, such as trembling, sweating, and a racing pulse. Number 3. Voracious appetite. Your body is trying to inform you that your blood sugar is dropping when it suddenly causes you to feel hungry for no apparent reason. You can maintain healthy levels of blood sugar by carefully monitoring the number of carbohydrates that you consume on a daily basis. The American Diabetes Association suggests consuming between 15 and 20 grams of carbohydrates with each snack and between 40 and 65 grams of carbohydrates at each meal as a good starting point. However, you should speak with a dietitian or a certified diabetes care and education expert to determine what is best for you. Number 4. Restlessness during nights. A significant number of sleep issues can be brought on by nocturnal hypoglycemia, which accounts for approximately half of all instances of low blood sugar. Night sweats, bad dreams, crying spells, and a feeling of unease and confusion when you wake up are some of the symptoms. There are also other signs. If you consume something light before going to bed, your sleep problems are less severe and less frequent. Before you go to bed, your blood sugar levels should be somewhere between 90 and 150 milligrams per deciliter, as recommended by the specialists. Number 5. Shakiness. A person is said to have a body tremor when one or more sections of their body shake in a rhythmic pattern. This shaking is brought on by the muscles in the body contracting involuntarily. Shaking is a symptom of hypoglycemia, which occurs when the automatic nervous system is triggered, according to studies that were conducted on patients. When you're anxious, you probably notice that your forearms are shaking the most. It's not just the body. The arms, the legs, the brain, and the vocal cords also shake. Muscle contractions that occur on their own make up its rhythmic pattern, which has a very specific structure. It is possible that the shaking will take place at irregular intervals or constantly. Number 6. Unstable emotions. Mood swings and sudden emotional outbursts that are out of character with your typical behaviour have been shown to be neurological indicators of hypoglycemia. Among these can be found traits such as irritability, stubbornness, and melancholy. Number 7. Dizziness. When your blood sugar is low, you may start feeling dizzy. This is because your brain is attempting to preserve as much energy as it can. If you are experiencing this common symptom of hypoglycemia, medical professionals recommend seeking treatment as soon as possible with 15 to 20 grams of fast-acting carbohydrates such as juice. You should also try lying down, and if the dizziness lasts for more than quarter of an hour, you should seek medical assistance. Number 8. Having trouble focusing. Because the brain depends on blood sugar for energy, it might not work correctly if there is a drop in glucose. Because of this, it might be challenging to focus on one thing at a time. The good news is that research suggests that moderate hypoglycemia episodes do not appear to cause permanent brain damage. Number 9. Eye issues. Vision problems that seem to emerge out of nowhere could be the result of a sudden drop in blood sugar. According to a previous case study, the most common eye-related symptom experienced by patients is impaired vision. This symptom is experienced by the majority of patients. A significant number of individuals also report seeing blurry images and dark spots in their field of vision. Number 10. A speech pattern that is slurred and clumsy. Your vocal quality might change if you don't get enough sugar. Slurred speech is a common symptom associated with blood sugar levels that drop below 40 milligrams per deciliter, as stated by the University of Michigan Health Systems. Clumsiness is yet another symptom of having low blood sugar. If these two symptoms surface at the same time, it may give the impression that you have consumed several drinks, even if you haven't had a sip of anything. Number 11. Paleness. Paleness is when normal skin or mucous membranes lose their colour in a way that isn't normal. It might be a sign of dropping blood sugar. The whole body is affected by a general pale complexion. It's easiest to see on the face, around the eyes, inside the mouth and on the nails. Most of the time, only one limb is affected by local pallor. Number 12. Palpitations. The sensation of palpitations is similar to that of your heart beating abnormally quickly, skipping pulses or fluttering. There is a possibility that you will feel palpitations in your chest, larynx or neck, and this could be an indication that your blood sugar level is too low. Now, as I mentioned at the outset, things become significantly worse in the most extreme instance of a blood sugar drop. When things intensify, the patient may experience passing out and seizures. A seizure is sudden aberrant electrical activity in the brain. It might pass almost undetected, or in more severe cases, it might result in convulsions, which are violent shaking fits. In case of severe blood sugar decline, seizures start abruptly. In severe hypoglycemia, it is possible to briefly lose consciousness. We've practically covered every sign of low blood sugar which should enable you to recognize the issue and take appropriate action. But we're not finished yet. It's important to keep in mind that hypoglycemia is not always associated with diabetes because it can occur in individuals without the condition. Non-diabetic hypoglycemia comes in two forms. Reactive hypoglycemia, it is caused by having too much insulin in your system and occurs a few hours after eating a meal. Other potential factors comprise stomach operations and a few uncommon enzyme defects. Fast hypoglycemia, it can be brought on by a number of factors, including the use of medications like aspirins and sulfur drugs, excessive drinking, and illness of the liver, kidney, heart, and stomach. This kind of hypoglycemia can also be caused by certain tumours and low amounts of certain hormones. And finally, as I promised, let's discuss some helpful tips that can prevent you from suffering from low blood sugar, which is all about what you eat and how you eat. Basically, if you take too much insulin compared to the quantity of carbohydrates you consume, you could experience low blood sugar. So here are 4 tips that can help. Avoid consuming a dinner that is high in simple sugars. Never skip a snack or skip a complete meal. Avoid eating later than normal. Don't consume booze without eating something. With this, we wrap up this episode. Have you experienced any of these signs of low blood sugar? What remedies did you take? Let me know in the comments below. And if you like the video, do hit and like the subscribe button. Thank you for watching. See you in my next video.